Today's video is week 4, part 2 of the virtual surgery for sports hernia. If you have not found our first part, week 3, check out those. It goes over deep core exercises and really sets you up for success for week 4. The goals of week 4 are to reduce pain and to really start to challenge and strengthen the posterior chain, backside muscles, and frontal plane exercises. So our first exercise is bringing one leg into hip flexion, but before we do so, let's remind you of that deep core. I think people really do this one not so well sometimes because they forget that the lower abdomen is probably the most important part here. So we're going to breathe deep, deep into the belly as always, right below the belly button and into our sides. And once we have that, we're going to bring this leg into flexion. 90 degrees is pretty good. If this is painful for you, maybe find the range that works best, okay? From here, we're going to take our hands. This is the part I really like to build in for this exercise. Push through the floor, and you're going to feel your belly working a little bit more. Somebody comes to try to lift your hands up, they shouldn't be able to. And then we're going to take this straight leg, and we're going to drive our heel away from our head. Into the floor, heel away from the head. Hold, breathe. Maybe 3 to 5 breaths, relax and take a break. We don't want you moving here, so this is all just finding a stable position and breathing into it. Do that for maybe 5 to 8 reps, holding for 3 to 5 breaths, a little less if you feel like it's uncomfortable or you can't tolerate it as well. For this next one, we're gonna work on hip abduction, so bringing the top leg up towards the ceiling. What I like to do is actually do it on my shoulder here and support the head. And the missing component a lot of times when people are doing this exercise is not allowing the spine to get into this side bending position. So what you're going to do is allow like a little mouse to crawl underneath your torso here. Keeping that tunnel, we're going to take the top leg, we're going to reach it out and keep it on the floor. Find your breathing in this position. If you feel like you have a really hard time breathing in this side position, play with that pelvic angle. You may notice creating a bigger tunnel helps you breathe deep into the side. From here, stretch into the fingers with your breath, lift, hold, maybe 5 breath holds here, and slowly lower down. Another missing component I see a lot of times really people butcher this exercise is by coming up too high and allowing the spine and side body to do a lot of motion here. So we want to keep a stable base, tunnel, breathe, only lift as high as you can actually control that, 3 to 5 breath hold, and slowly lower down. Do that for 5 to 10 reps and switch to the other side. Next exercise is actually challenging hip extension, okay? A lot of people will do hip extension. Maybe some people do these kind of just like kicking motions here, or other people will be doing like Supermans to get their spine and their hips into extension. I personally like to teach the bird dog exercise. Bird dog is very familiar to a lot of people, but the tension that you can build in this can be the missing component for a lot of people. So we're going to come to tabletop here, okay? We're going to find our stable base and our breathing as always. We're going to first push our hands through the floor. So we don't want to be super lax here. We want to start to grow away from the floor. And we're going to take one leg, and we're going to slide the toes across the carpet, not allowing your pelvis to do any of this excessive motion. The pushing hands through the floor should help you with that. Slide the toes, drive the heel far, far, far behind you, and if you feel stable enough, reach high and squeeze hard with the opposite hand for 5 seconds, and then slowly control those back. You can control them back at different times, or you can do it together. Okay, once you feel like you got really good at this exercise, we breathe, we drive and reach, we hold, 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 and then we control it down. 5 reps, 5 breaths each side. This next exercise is a bridge, which we've done before, but we're going to build some of the little bit of the injured tissue into this. So we're going to take something like a yoga block, a ball at home, a pillow, a rolled up towel, whatever has a little bit of give to it, but also some resistance, and we put it in between the knees here, okay? A lot of times what I see is people really try to challenge the adductors in this injury, and I think it's too much. So if you putting this here and giving yourself a light squeeze is creating a lot of pain for you, I don't think you're ready for this. Go back to old exercises, spend more time there first. And if it feels like it's too complicated, you don't know when to progress, click on that free sports hernia recovery plan that's in the link below, okay? So what we're gonna do is we're gonna take the object that we're using and put it in between our knees. We're gonna breathe first, so remember neutral pelvis and spine, breathing and breathing as always. When we have that, we're gonna give our squeeze in between our knees 30% effort. You're gonna notice when you build that squeeze in, you're gonna feel the activation in that lower abdomen happen even more, okay? It should be fairly pain-free for you. Keeping the light squeeze, keeping the breathing, we build in the bridge, and we control it back down, okay? Pair your breath with it. Squeeze, lift, and down. This one isn't about how high you can go, it's about what you can control. So try maybe 8 to 10 reps of that for about 2 to 3 sets. Okay, and the last exercise, which I mentioned is my favorite, is because there are many ways you can perform this one and everybody's a little different. So I'll show you some progressions and regressions of this single leg bridge. We've already done a double leg and we've already done the adductor squeeze one. So as long as you're tolerating those, you can now start to challenge the single leg version, okay? So let's see if we can even tolerate holding our leg up at 90 degrees like so. If we're breathing and we're lifting, we're gonna try 6 to 8 reps of that on each side, okay? Again, the height isn't super important here. Maybe get to where it feels challenging, give yourself a little extra push through the floor, and then control it back down, okay? If you want to, as long as the hip and the groin feels okay, you can hold on to that leg. Might make it a little bit easier to play with. If that creates pain and discomfort, move away here, okay? Or extend the leg out and push, okay? This is probably the hardest version here. Another thing that we can do is take our hand, push on that knee, give yourself a little extra abdominal effort there as we get up into our bridge. Note which one feels the most challenging and work your way up to that one. 6 to 8 reps on each leg, 2 to 3 sets. Another thing to keep in mind this week is if we talked about walking in part 1, we can start to talk about cardio in part 2. Something like the bike, the elliptical, to get the heart rate up to help with recovery is something you can think about this week. Stick around for part 3, which will talk about progressions in this virtual surgery.